whenever you study about a medicine, please focus on patient counseling as well. Like for example, yesterday, some days before, I was actually talking to one person, okay, and I asked them, what is the side effect of phenytoin, okay? So that person told me that phenytoin causes gingival hyperplasia. So I think you know what is gingival hyperplasia. Gingiva means it is related to the gums. Hyper means big. Plasia means growth. So gingival hyperplasia is a condition in which in between your teeth, gums will start growing. Basically, your gums are usually hard in nature, but when gums start to grow in between your teeth, they are usually soft and tender. So if this kind of patients are using toothbrush which is of hard bristle, like we have three kinds of toothbrushes. We have soft bristle, medium bristle and hard bristle, right? So for example, some people have this psychological tendency that if you brush your teeth like anything, if you vigorously brush your teeth, it will become white. Some other people have this kind of tendency that if you're using a hard bristle toothbrush, then only your teeth will be white. Some other people have this kind of tendency that if you're brushing your teeth for a very long duration, then your teeth will be bright. All of these are wrong. You just need to brush your teeth in the correct way, that's all. So if you are a person who is using hard bristle toothbrush, and if these gums are growing in between your teeth, so what will happen? As I said, they are usually very tender. The chances of them getting ruptured, and then you start having gum bleeding and all this kind of problems. So one advice that we can give to this patient is not just to maintain your oral or dental hygiene, but also to use medium or soft bristle toothbrush, especially if you are using that medicine for a long term. So this is something that I derived from a scientific theory, and this is something about, it's just like a common sense kind of thing. But when I talked to that person who told me about gingival hyperplasia, what did that person say? I'll tell you. Sir, phenytoin causes gingival hyperplasia, so we should advise the patient that it will cause gingival hyperplasia and they should be aware. Now, when you are talking to a patient and if you say gingival hyperplasia, how do you expect the patient to understand? Is the patient scientific like us? Is the patient from a medical background like us? No. So patient counseling means we have to talk in their language. So we have to tell them that this medicine can cause some problem with your gums. So please make sure that you don't brush your teeth very hard. And if you are brushing your teeth, please use soft or medium bristle toothbrushes. So, and there are other forms of counseling also, like should you take the medicine before food, should you take it after food, and at what time of the day should you take. For example, there is a medicine known as clozapine. Clozapine is one of the most dangerous medicines in the treatment of schizophrenia. If you are having schizophrenia with severe aggressive and suicidal tendency, clozapine is the best choice because it blocks dopamine type 4 receptor. So, clozapine has a problem. Because of its anticholinergic side effects, it causes sedation. So just imagine if you are taking that medicine in daytime and you are working outside, or maybe you are a person who works in the industry or who deals with dangerous chemicals, or if you are a physician itself, and if you are taking this medicine at daytime, just imagine what will happen. You will get sedated and this can increase the risk of accidents. So basically, clozapine, the best advice that we can give to the patient is, as much as possible, please take it at night time because of its problem of sedation. So patient counseling is also something that we should focus on. It's not just about giving a medicine to a patient. You should also make the patient aware about the proper way of taking the medicine so that the treatment is rational. That means the efficacy is more and the risk is less.